Ginger is a popular root known for its many health benefits. People all over the world use it to help with digestion and to ease nausea. It has been valued for its healing properties for centuries. While ginger is often praised for its therapeutic effects, there are times when it may not be the best choice for your health. In this video, we will explore situations where ginger might not be the right option for you. It's important to make informed decisions about when to consume ginger. Knowing when to avoid ginger can help you enjoy its benefits while keeping yourself safe and healthy. Before we begin, it's important to note that all the information in this video has been carefully researched and reviewed by qualified health professionals. You can trust that the facts presented here are accurate and unbiased. Now, let's take a look at 9 instances when it's best to steer clear of ginger. Number 1. Diabetes. Ginger has been found to possibly lower blood sugar levels, which might sound good, but it can actually be risky for people with diabetes who need to carefully manage their blood sugar levels. Watch out for sudden drops. If blood sugar levels drop too quickly, it can cause dizziness, weakness, and even fainting. This is why it's important for diabetics to keep a close eye on how much ginger they consume. Ginger has natural properties that can thin the blood, which can be a problem for diabetics who already have issues with blood clotting because of their condition. Eating too much ginger could make this problem worse and lead to more complications for diabetics. Some diabetics may have trouble with digestion when they eat ginger, which can make it even harder to manage their diabetes effectively. Number 2. Heart conditions. If you have a heart condition, using ginger might not be the best idea. Ginger can actually make your heart work harder because it improves circulation. This could be risky for people with heart problems because it might make their heart beat too fast. Furthermore, ginger's natural blood-thinning properties can potentially exacerbate the issue and lead to adverse cardiovascular effects. This can be particularly problematic for individuals with heart conditions who are already using blood-thinning medications. The interaction of ginger with these medications may further thin the blood, increasing the risk of complications like excessive bleeding or bruising. Number 3. Bleeding disorders. If you have a bleeding disorder, it's important to be careful about what you eat. Ginger is a popular spice and herbal remedy, but it can be risky for people with bleeding disorders. This is because ginger has properties that can make bleeding worse in these individuals. The active compounds in ginger, like gingerol and chelate, can interfere with the body's natural clotting process. This means that people with bleeding disorders may experience prolonged bleeding if they consume ginger. If you have a bleeding disorder, it's crucial to talk to your healthcare provider before adding ginger to your diet. They can give you personalized advice based on your specific health needs and the severity of your bleeding disorder. Number 4. Underweight. Ginger is known for helping with digestion, reducing nausea, and fighting inflammation. But for people who are trying to gain or maintain a healthy weight, these benefits can actually be a challenge. One of the reasons ginger can make it hard to gain weight is because it speeds up the digestive system. This can lead to more digestive enzymes being produced, which in turn can boost metabolism. Faster metabolism can mean that the body absorbs nutrients more quickly, making it harder for someone to maintain a healthy weight. Ginger can also suppress appetite, making it difficult for someone who is underweight to consume enough calories to gain weight. If you're struggling with being underweight, it's important to talk to a healthcare professional or a nutritionist for advice on how to manage your weight effectively. While ginger can be beneficial for many people, those who are underweight should be cautious and consider other options for maintaining a healthy weight. Did you find this video helpful? Please consider liking and subscribing to our channel. Number 5. Gallbladder issues. When your gallbladder is not working properly, it has a hard time releasing bile, which is important for digesting fats. Ginger is a spicy herb that can make the gallbladder produce more bile, which might cause discomfort and make the condition worse. Since ginger can thin the blood, it could be risky for people with gallbladder issues. Any problems with the gallbladder can lead to bleeding and other serious health problems. What should people with gallbladder issues do? Should they avoid ginger? Even though ginger has good properties like reducing inflammation and being an antioxidant, people with gallbladder issues should be careful when eating it. What should they do instead? It's best for them to talk to a doctor before adding ginger to their diet. It might make their symptoms worse and slow down the healing process. Drinking chamomile or peppermint tea could be a safer option for managing gallbladder issues. Number 6. Pregnancy. Some studies suggest that having too much ginger while pregnant could possibly increase the chance of losing the baby before it's born. It's better to be safe than sorry, especially in the first few months of pregnancy when the risk of losing the baby is higher. Ginger can make your blood thinner, which might cause issues during childbirth or any related procedures. Using ginger might lead to more bleeding, which could make giving birth harder or cause problems after the baby is born. Also, ginger could give you heartburn or make your stomach feel weird if you're already prone to having tummy troubles. Before you start adding ginger to your meals while you're pregnant, it's a good idea to talk to a doctor first. They can help you figure out if it's safe for you and your baby. Ginger can be great for your health when you're not pregnant, but it's important to be cautious when you are. Make sure to talk to your doctor and not overdo it with ginger to keep you and your baby safe and healthy. Number 7. Medical interactions. If you're taking medications for clotting, high blood pressure, or diabetes, you need to be cautious when it comes to ginger. Ginger has natural properties that can thin the blood and lower blood pressure. This means it could interfere with how your medications work and potentially cause unexpected health problems. If you're on medications like warfarin or aspirin for clotting issues, you need to pay extra attention to your ginger intake. Consuming ginger alongside these medications can increase the blood thinning effects, putting you at a higher risk of bleeding. For those on medications to control blood pressure or diabetes, ginger can also affect your blood pressure and sugar levels. This could make your prescribed treatments less effective, so it's important to be mindful of how much ginger you consume. Number 8. Affecting sugar levels. When getting ready for surgery, it's important to think about what you eat and any supplements you take. Some foods and supplements can interfere with how your body responds to anesthesia and other medications during the operation. Ginger is a popular spice, but it can increase the risk of excessive bleeding during surgery. This can make the surgery more complicated and lead to more problems afterward. Additionally, ginger can affect sugar levels, which is a concern for people with diabetes. It may interfere with their insulin intake and cause fluctuations in glucose levels during the surgery. Having stable sugar levels is crucial for a successful surgery and a smooth recovery. Healthcare providers usually advise patients to avoid consuming ginger before surgery due to its potential impact on clotting and sugar regulation. This includes ginger in any form, such as supplements, teas, or as an ingredient in food. It's recommended to stop consuming ginger at least 1 week before any scheduled surgery. This helps reduce any risks and ensures the safety and well-being of the patient throughout the entire surgical process. In conclusion, ginger is a versatile and healthy spice with many benefits. However, it's important to be cautious and avoid ginger if you have any of the mentioned issues. Always consult a medical expert before adding ginger to your diet to enjoy its benefits without any worries. Number 9. Low blood pressure. Ginger has some active components like gingerol and serine that make it special. These components work as vasodilators, which means they widen blood vessels and make blood pressure go down. If you already have low blood pressure, eating ginger can make it even lower. So, be careful and don't overdo it. Ginger can also make your body produce more hormones and neurotransmitters like serotonin and norepinephrine. This can also lower your blood pressure even more. This can be bad news for people who are prone to sudden drops in blood pressure, so it's important to be cautious when using ginger. Did you enjoy this video? Hit the like button and subscribe to our channel for more videos like this. See you on the next video.